costs continue to increase dramatically year after year, and then the stop loss insurance was increasing as well. And Cheryl Morgan was the first broker that I had in that had an alternative solution.
So we're here today with Dan from Danzer. You've been a client with Cheryl Morgan for a while now, so we appreciate your time and to share a little bit of your wisdom with the audience. Dan, I don't know if you could give us a little perspective on your journey so far, and if we could start with what was health insurance for you 10 years ago when you started this journey on being self-funded?
Yeah, the healthcare benefits, obviously, it's a concern of every organization. It's a high cost element. And in our situation, our costs continue to increase dramatically year after year. And then the stop loss insurance was increasing as well. We had a lot of problems with employees and we call high claimants, which is generally drives a lot of your cost in the plan overall. So we continue to have trends in both high claimants and then the cost was escalating. So our parent company is in Europe, so they don't have issues like this, and they're able to budget their health. And they have national health care, and it was a real concern. So we had to address this at every board meeting. And then I went through several brokers trying to find that answer or some alternative than the PPO plan we were using. And their only recommendations was basically the same stuff, plus a high deductible and adding all these different types of plans that end up confusing a lot of our employees. And for me, it just didn't make sense because a high deductible, it seems to me, you're trying to get your employees to the hospital, not the opposite, that they can't afford the proper health care. So we met Blair, I think, through one of our HR representatives in Indiana. We decided to go outside of Western Pennsylvania because we started to realize the brokers were only recommending either Highmark or UPMC, and 98 to 99% of their business was with those two organizations. So to me, there was never an alternative other than changing your plans, contribution for employees.
That's very interesting to say. I personally don't come from this world. I used to be an entrepreneur in medical devices, and as I'm learning, it's almost like you can't take the little thing that was created within the industry for insurance brokers. It's like high commissions, right? Like their drive is to get paid through very high commissions, and then they don't really think about the outcomes. And so that's why high deductible plans become a thing, and you think you're saving money, but at some point that balloons into the thing, and then you actually have a hot potato in your hand, and people are not doing the math, even about like value-based care, right? We tend to think that, oh, if I help you save money, you can pay me more. But in the course of years, you can save on year one or year two, but then year three, four, five, then all the stuff starts showing up. Like, what are you gonna do? You're gonna return my money?
Right, right. Right, that's exactly the thought process because you want your employees to get to the doctors. You want them to have their annual wellness checks to catch things early because they will mushroom into something serious if they're not getting the proper medication or they're not getting
Proper care.
taking wellness steps that they need to take per their doctor's orders. So interviewing new brokers, and I decided to go outside. The most of the brokers in the past we had were from Western Pennsylvania, who was more local to Danzer, where our headquarters is. And we decided to branch out outside of the Western Pennsylvania because they seemed to have that connection with either Highmark or UPMC, and that was your only alternative. So we came across Blair from one of our HR representatives in Indiana, and Cheryl Morgan was the first broker that I had in, even the other ones that I brought in nationally, that had an alternative solution. He had several alternative solutions, and one being reference based. So that's something I was looking for since I've been at Danzer, and we had this issues with escalating healthcare costs. I was trying to find alternative solutions other than the same solution every year. So Cheryl Morgan was able to bring that to the table and educate us on the reference-based pricing plan, and we decided to go that avenue and try it. We started in a hybrid format, and then we went full-blown the year after the hybrid.
So it wasn't Blair's looks that made you convinced that what he was saying was a great thing. So you actually were actively looking already for a different solution. It was actually a big pain point in your life already that you were seeking change. What was that catalyst that you actually decided to actively search for brokers? Was the fact that you received like a high bill on your insurance premiums or
Yeah,
on
you were like I said, I realized I started asking questions because we had several brokers and we had the same solution from every broker.
yeah,
And then our stop loss continued to increase and our medical costs were increasing dramatically year after year. And then I started asking them what is their portfolio. And I started realizing most of their portfolio as a broker was either UPMC or
got
Highmark.
got it.
So it seems to me there was a conflict of interest there that all their business is with these two firms. So that's a little bit of conflict of interest from my perspective. And I
Got it.
wasn't kidding. A broker's supposed to go out there and
And
just
find
like
you the best
anything in
solution.
insurance, put the best deal and the best alternatives, provide alternatives and be a part of the company and look from a company's eyes. And I didn't have that feeling.
That's fantastic. It's almost like you feel across the board with brokers. It's like real estate guy, right? That you must use one and they're supposed to work for you. But if you buy their house and then suddenly there's like a problem in it, they would just walk away and say, oh, well. And you're like, well, you should
Right,
have told me I was going to have a foundation problem here.
right, right, exactly.
And then we'll let folks read the business case. Fast forward 10 years. I'm assuming we're here because you're really happy with the performance of what Blair had been doing with Sherwin Morgan. I guess one thing that would be really helpful for the audience, for folks like yourself, I think you're in a unique position because you were also the CFO back in the days and now you're the CEO as well. So you had, let's say, both perspectives of like cost, but at the same time, you understand the value of healthcare to your employers. For folks that are in your shoes, like they haven't made that change yet or are thinking about it, or it's not that itchy yet for them to decide today, what would be a suggested recommendation if you could look back? Could you give some advice?
Well, first of all, it's no longer a topic at my board meetings because the savings have been, for us, it's have been dramatic. The savings, not only from a stop loss perspective, high claimants, the reference based pricing model, it makes sense to me. It was based on Medicare, so you're not having that jump. So, example, if a hospital like UPMC, they had a knee surgery and they charge you 1 year $10,000 and you got a 50% discount, you would pay five. But next year, that procedure might cost 15,000. You still get that same 50% discount, and then you're paying 7,500. Reference-based pricing made sense to me because it's based on Medicare and the changes in Medicare rates that they're paying physicians and stuff goes just with like inflation or even less than that. So you don't have that jump in my example that I just gave you. So that made sense to me. And then the other thing that really drove me was I was concerned about our employees. I wanted them to seek health care. I wanted them to go to their wellness exams to catch things early for not only the company's sake, but for their own families. So for me, it made sense to get rid of all these crazy plans that we had, all these options, and especially the high deductible, and change the whole organization to say, hey, we want you to go to hospital. So in that sense, we made the change to go to a copay, simple copay system, simple plan, one copay system, got rid of co-insurance. The employees were limited to a certain PPO before. They had to go in that network, or if they went out of network, they were going to have to pay a lot more. Now they can seek any position or any service that they want of their choice. So we changed the whole mentality for the company to make, and the employees appreciated to allow to go to any person that they wanted to go to and only have a simple copay. And in many of the wellness exams, there's no copay. And Sherwin Morgan even has concierge services to help our employees. They set up programs for less fortunate employees. So it's really benefited our employees both from contribution standpoint and what they're paying for healthcare today. It's changed our whole financial structure and
Yeah.
we saved a lot of money in actual claim payments and then also stop loss. Our stop loss actually we were facing a huge increase as your business case will tell you. And today I think we're back to 10 years later, it's back to where it was before that. I was facing that big increase. So for us, it's been a win for not only Danzer, but it's been a huge win for our employees as well.
The key takeaway I take here, like for folks that are in your shoes, but they're not feeling that pain just yet. I think just hearing you say that healthcare is no longer part of your board discussions, it's already something that will open their eyes, right? Like the 10,000 things you gotta fix. If healthcare is not that one problem you gotta fix, you're good. And then the fact that You simplify life to your employees. The fact that they can go anywhere and just get their care and not feel like they're trapped and having to navigate thousands of books or apps to figure out where I can go and who I can book, otherwise it'll break my bank. I think that's super powerful. The last comment is we're going to try to do a little promo for the event. So I know you've been going to the Sherwin Morgan Healthcare Conference. If you could just give a few sentences of what did you learn in the past few years and if folks should consider going.
Yeah, it's a tremendous opportunity for everybody. It's a conference that Cheryl Morgan puts together. It's very first class. They bring in all kind of great speakers. So it's a chance to learn if there's something new or something that can help your organization or your employees. It's a super opportunity and highly well run. It's no cost other than your travel and your hotel room. What other place does that? I don't really know. And I got an opportunity one of the years to be one of the speakers to, as we're doing today, is discuss what the reference-based pricing model has done for us as a company. So I
It's
think they're always
hilarious.
trying to help other organizations and let people know all the innovations and all the things that are coming down the line that maybe perhaps could benefit your employees and your company.
That's how we met
Yeah,
because I was trying to navigate the system with my breast cancer startup, and I have no clue because I wasn't part of any guideline. I didn't have any support. Everyone was happy with the way things were ran. And then Shira Morgan introduced us, and you're one of the first to be open to at least hearing us out, right?
if I can't make it for some business reason, I always encourage our HR representative to join that meeting because it's really a great thing that Cheryl Morgan puts together every year.
Yes, this year we have way more stuff. I'm helping organize, so super excited. Well, then I appreciate your time.